There are at least 14 things that we can modify, the vast majority of which are in the middle part of our life. They're sort of key things that if people can be mindful of the impact that these things have, I think the impact will be very significant.
Welcome to the HSE Talking Health and Wellbeing podcast. In today's episode, we're going to discuss brain health. I'd like to introduce you to Dr. Sean O'Dowd. You're very welcome, Sean. Thanks for joining me today.
Thank you, Noreen.
Sean is a consultant neurologist with a special focus in cognitive disorders and dementia. He's been the clinical lead of the National Dementia Services since October 22, and he has many years of experience in the field. Sean is also the co-director at the Cognitive Clinic at Tallaght University Hospital, which has become an integral part of the Regional Specialist Memory Centre. So thank you very much for joining us today, Sean. Now, the first question I wanted to ask you about, why did you choose neurology? I know you weren't expecting that, but brain health is such an interesting subject, but there's so many other areas, and I'm just wondering what drew you to that.
It goes back probably to medical school where, you're exposed to different basic subjects, and the neurological part of the basic sciences like the neuroanatomy, like what parts of our brain are responsible for what functions, and neurophysiology, which is, a similar sort of concept, just really intrigued me. And from there, I just, as a student, did a rotation in a kind of a really reputable neurology centre in London. And then I was sort of hooked, from my junior doctor days. It was something that I really kind of wanted to focus in on. And I think, the brain is just such a fascinating organ, and it sort of defines who we are. And in a lot of aspects, it's sort of the last frontier of medicine. We've managed to innovate so many great interventions and treatments in things like cardiac care and cancer care that the neurology piece is the last frontier, and we're slowly getting there. But I just think it's sort of an area that's really sort of an exciting area to work in.
Yeah. So tell us a little bit about our brains and what it does for us.
So the brain, I guess, is the pivotal organ in terms of defining how we learn, how we behave, how we interact with other people. Broadly speaking, when we're teaching our students, we talk in very basic terms about sort of the lobes of the brain and what their function is. The frontal lobe is the part of the brain which is involved in our judgment, our ability to juggle information, to make decisions, to plan. The temporal lobes are involved in memory, so storing memories and being able to recall them. The parietal lobe is involved in sensory information and the planning of complex tasks. And then the occipital lobe at the back of the brain is involved in integrating and processing our visual environment. So it's sort of the seeing part of our brain. And then deeper within the brain structures, there are movement centers, balance centers, and a whole array of sort of cross wires that are called white matter that link all of these different parts of the brain together. So from a very early age, the brain is developing as we learn from infancy, language, motor skills, behavioural skills and abilities. And that's something that the brain has a very intrinsic capacity to learn new things even as we get older. It really, I guess, is a very fascinating organ in relation to how plastic it is. And we sort of feel that, as I said, it's sort of the last frontier of medicine is our understanding, because there's still lots of parts of the brain that we don't really fully understand how they work. But a lot of research is going into better understanding the pathways. So we talk about pathways and networks now in terms of how things work when we want to perform a task or learn something.
Yeah. So we were more conscious as time goes on, I think, about a healthy body. Yeah. We can see our bodies, if we're running or walking or exercising. But what is a healthy brain, and how do we keep our brains healthy?
It's something, like you say, it's probably getting rightfully more attention now, having lagged a little bit behind some other aspects of our health. And brain health is, from a public health point of view, and governments and policymakers internationally now, it has become a priority, because our brain, like other parts of our body, is a little bit vulnerable to aging. And therefore, there are things that we need to sort of be mindful of as we are going through our life cycle about what we can do to maintain a healthy brain. So the WHO actually have a definition for brain health: the support or the optimization of brain development, of cognitive health and well-being throughout the life cycle. And there's a whole plethora of lifestyle choices or discretionary kind of activities that we may choose or not choose to do that can impact on brain health, as well as other aspects of our physical health that can also impact on our brain health. So I suppose broadly speaking, we would talk about the importance of staying, physically active is really important for our brain health. staying socially active and socially engaged is really important for our brain health. And staying cognitively active or stimulated mentally is really important for our brain health. And there's been a lot of work looking at the importance of those, big areas in establishing, laying down good brain health and then in preserving it and protecting it as we age.
So for our listeners, what would that mean on a daily basis? What would they need to do, say, if you're at my age, if I'm thinking I should start preserving my brain and my brain health, what are the type of things I should be doing on a daily basis?
So there's been a lot of work looking at this in research, very large scale studies looking at big populations and kind of observing the impact that different factors in our lifestyle can have on our brain health, and particularly, I suppose, what we call risk factors for dementia, which is where our brain health has been impacted to a point where it's, affecting day-to-day function. So the Lancet Commission is a body of very sort of senior medics and scientists who review this sort of data every few years. And they've just published a revised report in the last month on the risk factors for dementia. And then I suppose the flip side of that, the things that we know that if they're managed well can preserve brain health. So most of those are in what we call middle life, which would be, I suppose, defined as anything from maybe 40, 45 up to 65 or so. And some of them are kind of medical things and being aware of the need to have, for example, a blood pressure check. So untreated high blood pressure is a risk factor for the development of dementia in later life. Having cholesterol checked, similarly, untreated high cholesterol can be a risk factor. Type 2 diabetes, a lot of people, we have a significant problem in every Western society with overweight and obesity. And a lot of people may not even be aware necessarily of what their status is in that regard, or what we call BMI. So both obesity itself and type 2 diabetes are risk factors for the development of dementia. As such, really, it's critical for brain health to maintain a healthy weight and to exercise. And then there's the whole concept of social connectivity. And again, that's something that the data has very strongly shown that social isolation is a risk factor for dementia. And it's something that I guess we saw all of us in day-to-day life during the COVID pandemic, the impact that lack of human connectivity had on people's general well-being. But we've also seen it in the clinic in terms of the effect that it has had on people's cognitive well-being or brain health.
So it'd be very obvious to you if somebody comes in and they're living in isolation.
Yeah, I mean, certainly something in practice that you would see that the person who maybe might be more socially isolated or not have a network of family or community supports particularly, we tend to see those people maybe present a little bit later from a clinical point of view with cognitive difficulties. And I think particularly during the pandemic, it became, or certainly its aftermath, it was something that sort of became very evident that for those who might have had maybe limited social contact, where that was then taken away, like the trip to the bingo club or the trip to the Greyhound track or what have you, where that was all, put on ice during COVID, that it seemed to have something of an accelerating effect on their cognitive issues.
That does make sense. And there's more and more information coming out about the importance of social connectiveness and loneliness and everything.
Yes,
so
absolutely.
It's such an important point. And was there something else about hearing loss as well? Was something totally new for me? I didn't actually realise that this had an impact.
Yeah, so hearing loss, it often surprises people in terms of these risk factors for dementia. And there's 14 of them. And each of those has been given a sort of a percentage to which it can contribute to the overall development of dementia in the population. And surprisingly, hearing loss is the biggest risk factor in there, in a kind of a pro rata percentage sort of basis. So in other words, there's 14 risk factors there. But if you were to identify and treat hearing loss in middle age, you could potentially prevent 7% of cases of dementia, which is quite a bit when you think of it at a population level. There are a few different theories, and I guess there's probably two complementary theories as to why hearing loss impacts our brain health. The one being that hearing itself is kind of a very integral or central part to brain function, and the auditory or hearing pathways in our brain are the key component of how we interpret our environment and engage with other people, so that if that is impacted, then by default it's not being stimulated, or as they say, use it or lose it in kind of broad terms. And then secondly, that the concept of the social or the personal effects of hearing loss. And we see this in practice in clinics and in day-to-day life. People who have hearing impairment have a tendency to maybe take a little bit of a step back from interaction with families, with communities, with activities. and therefore that probably impacts on their level of sort of cognitive stimulation.
So it's nearly back to the social isolation again, because people can isolate themselves. I'm just thinking about a relative of my own, because her hearing loss, she would kind of sit back when we were in a group because she couldn't hear us, and she would withdraw from the group.
Yeah.
So it's again that connectiveness with other people.
Yeah, that's right. Absolutely. There's quite a bit of data showing that if hearing loss is identified and treated, most commonly with hearing aids, that reduces the individual's risk back to that of what it would have been if they had normal hearing in terms of their impact on their brain health and the risk of developing dementia.
So I suppose for the listener now, it just shows the importance of wearing those hearing aids, because so often you do hear older people or people who have hearing impairment saying, oh, they're uncomfortable, I don't want to wear them. So the message would be to please wear your hearing aids.
That's right, yeah. And like any sort of intervention or aid or device, there can be tweaks and individualised changes to these things to make them more comfortable or more suited for an individual, and not to give up and be disheartened because the first time they put them on, they find them uncomfortable or that the setting isn't quite right. But to stick at it and to engage with the audiology service that they've seen to get the right fit and setting for themselves.
If somebody needed to get a hearing assessment, how would they get it, or where would they go to for a hearing assessment? Probably their local audiology.
That's right.
Go to their GP.
Yeah, exactly. So there are a number of different audiology units and services. Some ran through the HSE, and then there are a couple of agencies like Chime, which offer free hearing screening. Yeah. And again, the local knowledge base from the local GP or local pharmacy in terms of directing for local hearing assessments is always the first protocol.
So supposing if somebody was listening and they think, well, you know what, I think I just have my memory isn't 100%, I seem to be forgetting things. And I always think that people are very good at covering up those things as well. What should they do? Or is there a way that they can, or someplace that they can go to find out, are they developing memory loss or are they developing brain problems? Yeah,
particularly in middle life, it's normal to experience some cognitive changes, but not necessarily cognitive deterioration. So, I mean, I think, our brain is at its prime when we're in our very early 20s. And then naturally, with aging, certain aspects of brain function change a bit. And say our speed of processing information, our reaction time, the ability to, for example, quickly put a name to a face. That's sort of a normal experience as we get older.
I can identify with that. Thank you very much.
Yeah. Or, just the immediate attention span.
Yeah.
In your early 20s, people can often rattle off a telephone number when they've been, given a new one. And that's not something that comes as easy as we get a bit older. And that's all normal. But where, there's a more significant problem and concern about how memory is impacting and day-to-day function, and it's causing a bit of unease or distress, the first port of call really in that setting is always the GP, and our colleagues in GP are very skilled at looking at cognitive and memory difficulties in people who come forward for assessments. And sometimes somebody can be very easily assessed and their mind put at ease that what they're experiencing is normal, or that they may be some other extraneous or factor going on in day-to-day life, be that trouble with sleep or untreated pain or an untreated medical condition or stress or, anxiety or significant mental health issues, which can be treated in their own right. And sometimes in that setting, the cognitive difficulties will resolve. But equally, the GP will very often, if they have any concern, refer on to a specialist memory clinic for assessment. And that's something which we'd always be keen to encourage people is to, if you have any concerns, see your GP and you'll be, directed and put on the right path from there.
Yeah. And can we retrain our brain? You hear about this neuroplasticity and the brain is a muscle, and can we retrain it?
The brain is a very plastic organ, and there's no doubt, and we know, for example, from other neurological disorders like stroke, for example, that there is an innate capacity for the brain to recover and regain some function, maybe not all function that might have been lost in something like a stroke. So the brain does have a capacity to retrain and to learn new things. And that's often the case right up into quite late in life. So it's really kind of never too early or never too late to think about brain health and to think about stimulating our brain. And it's really important for people to be open to engaging with kind of new activities and new tasks. The brain has an innate ability to learn and take on new information.
I suppose you'd think about people with traumatic brain injury. I know that's a completely different subject, but how the brain retrains itself and reroutes itself with somebody with a traumatic brain injury and how they can work.
Yeah, exactly. And similar kind of concept to stroke, that there has been, a big sort of insult or damage, if you like, but it doesn't mean that there isn't a capacity for rehabilitation and for things to recover to a certain extent.
And what about supplements and medication? And you hear all of these things now about different medications getting approved in America to stop dementia and to stop all of these things. Have we got those type of medications in Ireland, or where are we at with that?
So from the point of view of medication, so for somebody who has established dementia, so, where they've ran into difficulty with cognitive function to the extent that they're struggling or need more help with day-to-day function and day-to-day affairs, up until now, really, the mainstay in terms of medicines would be medications that are in the category of what are called cognitive enhancement agents. So they are useful for the symptoms in the sense that they make, things like day-to-day attention span and memory and concentration a little bit better, and most people get some benefit from that, but it's not indefinite and it doesn't affect the underlying kind of course of the disease, because dementia, by and large, there are lots of different causes, but by and large, these are kind of neurodegenerative diseases, so they progress over time. The holy grail that you refer to is medicines that can potentially slow down the progress of the disease or have an effect on what we call disease modification. It's a work in progress, I suppose. There have been a lot of very compelling, large clinical trial studies published in the last couple of years on a couple of these new medicines, which have been approved for use in a few parts of the world, such as the USA and Japan and China, and most recently in the UK. But they're not without potential side effects, which are very significant. So the European Medicines Agency, which the regulatory body for us here in Ireland, for example, has recently declined to approve one of these because, in their opinion, when they did their assessment for approval, they felt that the kind of risk-benefit ratio was unfavourable. It's sort of a moving field, if you like, and that decision, which was made by the EMA, is under appeal, as I understand it, from the pharmaceutical company that make that particular drug. There's another second drug under review with them. So it's a very rapidly evolving field. The fact that they will be available for use in the UK, of course, will raise awareness about this here in Ireland. And I suppose anything that raises awareness about brain health and the idea that we can intervene, be that from a lifestyle or potentially maybe from a medication perspective, is to be welcomed.
Yeah, no, absolutely. And what's the difference between mental health and brain health? How do you explain that?
It's a really good question because the terms are sometimes used a little bit interchangeably. Brain health is probably a more overarching term, a broader term. As I said, with that kind of WHO definition, talks about, kind of optimizing brain development as well as kind of cognitive health and cognitive well-being throughout the life cycle. So it's sort of a very broad concept about nurturing, supporting our brains from infancy to later life. Mental health is intricately linked to brain health, but I guess mental health refers more specifically to things related to mood and what we would consider, sometimes terms in the medical world, affective problems. So anxiety, depression, more specific mental health issues can include things like psychotic illnesses and so on. So from the perspective of the overlap between mental health and brain health, well, there is a very clear overlap because we know that, for example, midlife depression can be associated with a higher risk of dementia. And particularly if that's untreated, I suppose, and not intervened upon, there is some evidence suggesting that that group of people might be at slightly higher risk. Whereas depression, if identified and treated, is something which there are very good resources and medications and therapies for. The relationship between depression and later life dementia is complex, and it's probably a little bit of what we call chicken and egg, because while some people with depression are at higher risk of dementia by nature of the fact that they have depression itself, there's also some evidence suggesting that depression in middle life might be a very early part or forerunner of a neurodegenerative disease. So that's kind of complex. It's an area of a lot of study, but certainly identifying mental health difficulties and getting the appropriate interventions and treatments of and by themselves, of course, is hugely important, but also is an important component to a more overarching care for our brain health.
Yeah. And we've mentioned dementia a few times, and I'm very conscious that maybe this is just my own opinion, but I feel that people are unclear about dementia, Alzheimer's. What are the difference between them and the understanding of it, really? Yeah. These words are thrown around in the community, but do we really know what they are? Do we really understand ourselves?
Sure. To address the question, dementia is an umbrella term, so it's a very broad, generic term for a situation where somebody's cognitive abilities have declined to the point where they need more help or they're not able to manage things as independently as they were prior. There are lots of different causes of dementia. The most common cause of dementia is Alzheimer's disease. Alzheimer's disease is responsible for about 60 to 70% of cases of dementia. But there are lots of other causes of dementia, which can have some features in common with Alzheimer's disease, but sometimes be very, very different. So, for example, other common causes of dementia include Lewy body dementia, frontotemporal dementia, vascular dementia, Huntington's disease-related dementia. There are lots of different potential diseases. From the society point of view, I think there's, as you say, there sometimes can be a bit of confusion around the term dementia. Is it interchangeable with Alzheimer's disease and so on? And in fairness, I think there's a huge amount of work from the Understand Together campaign about raising awareness about what dementia is, and also in terms of supporting people who have dementia and people who are living in our communities with dementia, because most people with dementia are still living in our communities, for our communities to be more inclusive of and mindful of the fact that there are some in society who are affected by this condition, and making day-to-day interactions with, you know, various other parts of the world, be that the retail sector or the transport sector, just that bit easier, or to at least to be conscious of and to accommodate those people who may have dementia who are living in the community. So it's a work in progress, I think, within the National Dementia Services and the Understand Together campaign. Episodically, we look at sort of levels of awareness, of understanding of dementia in society through, you know, sort of surveys and so on. And that is rising incrementally over the last few years. So there is more understanding, I think, of what it means and the impact that it can have, and more thirst for knowledge around brain health and around dementia and around how we can support people to live as well as possible if they have an established diagnosis of dementia.
Yeah, and I suppose just for the listeners, they can go to the Understand Together website, and we did a podcast earlier on in the year with an amazing lady called Kathleen who has Lewy body dementia, and the whole impact of being involved in the Understand Together campaign has had on her life. It's worth people going back to listen to that if they want, or go to the Understand Together website, because they have so much information on there for people who are concerned. There's a huge community out there of a number of partners that are really trying to get this working in the community.
Yeah, that's right. Yeah, absolutely.
So they're really, really good. The other thing that people keep talking about, brain food. I mean, there's food for everything, obviously, but this brain food, what do you think about that?
From the scientific point of view, I mean, there's been a lot of work, not only within sort of the neurological field, but more broadly from a medical perspective, on the impact that diet has on our health, be it physical health, mental health, cognitive and brain health. And there's no doubt that a healthy, balanced diet is really key for brain health as well as other aspects of our health. And, you know, what does that mean? I suppose there's an emphasis on the concept of the Mediterranean diet, which is focused on things that are low in saturated constituents and that have a lot of fresh fruit and vegetables, and, you know, an emphasis on things like fish and maybe less of the red meats, and more of the white meats and so on. And that, you know, kind of Mediterranean approach to diet has been linked very significantly and very convincingly with better physical health, with better brain health, better cognitive aging and longevity in general. There's less evidence, I suppose, around specific nutritional interventions targeted at brain health or targeted at people who might have established cognitive impairment or dementia. We don't have a strong evidence base for those at this point, but it's an area of ongoing research.
So if somebody does have difficulty, it doesn't mean if they change the diet, we have no evidence to say that that is going to help. So it's really prevention then you're talking about with diet.
Yeah, largely. Although I suppose for somebody, you know, the same general health principles apply for somebody if they have cognitive impairment or dementia. Like, the focus would be around trying to encourage a healthy lifestyle. So a healthy, balanced diet certainly is a key component, but there's no particular evidence for any one approach or supplements or what have you for somebody who might find themselves in that situation.
So Sean, you've mentioned risk factors a lot. Is there any other risk factors that we should be aware about?
There are 14 in total, and some of them, as I said earlier, relate to sort of our lifestyle choices. You know, exercise is really important. So physical inactivity is a risk factor. And by physical inactivity, particularly we mean in middle life again. So the importance of going out, getting some aerobic exercise 2 or 3 times a week. And there's a lot of data again showing that adopting that strategy can be protective and preventive from a brain health perspective. And then smoking and alcohol are both factors that have been clearly associated as risk factors for the development of dementia, probably because we know that these are toxic things that we consume and go into our body. And there's a lot of evidence that these toxins are involved in promoting or provoking inflammation in our brains. And that sort of sets off a series of pathways that cause normal proteins to begin to behave abnormally and clump together and aggregate and lead to dysfunction or cells not working properly. And when that happens, we begin to develop cognitive symptoms. So there's a kind of a direct toxicity, which we know about from alcohol and smoking, as well as both of those contributing to general vascular risk.
Yeah.
And by that, it's sort of the risk of harm to our blood vessels, to our arteries, hardening of our arteries, as it's often referred to, or high blood pressure, which is another harmful thing for our arteries, and alcohol will contribute to that in and of itself. Again, in the Lancet Commission, it's a clear message each time they look at the data that smoking and alcohol are risk factors for the development of dementia, and therefore we would always advise people, if we meet them in the clinic, they're concerned about their memory, to try look at quitting smoking. There's very good supports, as I'm sure you'll flag with the audience within the HSE in terms of quitting, and to reduce alcohol intake to at least the guideline levels of intake. And again, there's a lot of data around the importance of moderating alcohol intake from a brain health perspective.
You mentioned there about people coming into the clinic. Is there a huge amount of fear with people who arrive in the clinic and they just know there's something not right? Are they really scared? Or how have you found people?
I mean, understandably, people can be nervous. Some people are understandably kind of worried and scared. But for the most part, I would think, in my experience in recent years, people's awareness of the importance of having their memory assessed, if they're worried about it, has really sort of increased and ramped up. I feel more inclined to come forward and to come forward earlier on, which is a good thing because it's sort of empowering. And people, I would say, and I know other clinicians in the area would say the same thing, there are a lot of people coming forward to the clinics concerned about their memory, who want to know if there is a memory problem. They want to know if this is something that will progress, that they want to know if they have cognitive impairment or dementia. Like, a lot of people that I would meet are actually really keen to have this information. And I suppose we've seen a huge shift in society about the importance of the person being at the centre of this process of autonomy, of them participating in decisions around assessments and management and their care if they have cognitive impairment. And in my experience, the majority of people who come forward, they are understandably a bit anxious and nervous, as we all would be with any health problem. But they do want this information because they want to be able to know the devil they're dealing with, for want of a better description, and to be able to know what supports they can get, what resources are there, what potential treatments are there, what research is there, and how to live well with this diagnosis, if there is a diagnosis of dementia at the end of the process, as well as being involved in stating their own wishes for the future and involved in planning for their own futures.
Yeah, that's really good, because I would have thought that years ago people were nearly embarrassed and used to hide it if they did feel like their memory was going. So that's really good to hear that there's a more understanding and more information out there for people.
Yeah, I think so. And I mean, there's still a fear, and there is still a certain probably component of stigma of the concept of dementia. But I think, again, through the Understand Together campaign, a huge amount of work has been done between the HSE and the other partners like the Alzheimer's Society and so on, around raising awareness of what dementia is. And the concept of this is something that people can live well with in their communities. Obviously, there can be, for some people, a time when they need a lot more support. But for the most part, as I say, the majority of Irish people who have dementia are living in their communities. And I think a lot of the work that the Understand Together campaign has done has brought us to a place where people are more inclined to talk about it, are less afraid, less stigmatized to say that they have dementia or that a family member has. And therefore that has trickled into a broader awareness in society and in healthcare about cognitive health, brain health, and, if you're concerned, having those things checked out.
Yeah, and September is World Alzheimer's Month.
That's
and
right. Yeah.
This September, 21st of September, is World Alzheimer's Day as
That's
well.
right.
So the more we're talking about it,
Yeah.
the more we're communicating the risks that are out there, the better it is for people.
Yeah, that's right. And there's still, a lot of work to be done. And I think we're sort of within the dementia clinical community, we sort of look at the work that's been done in other areas like heart disease, like stroke, like cancer. And kind of learning from those engagements with the public and really sort of seeing some of the benefits now of raising more awareness of dementia as something which is as common, if not more common than those things, and brings, its own challenges, but something that there is a huge amount of value in early intervention and early recognition.
Yeah. So over the next 10 years, Sean, would you be optimistic about all of the research and the evidence that's coming out in relation to brain health? And do you think we are making inroads into it? Or what would you say to our listeners about how they can help with that and how they can make inroads into improving their brain health?
Yeah, I would be optimistic. I mean, I think, the amount of people in our society with dementia is increasing, but that is reflective, I suppose, of the fact that our demographics are changing. So our society is getting older, and age of itself is one of these risk factors for dementia that we can't modify. But there are at least 14 things that we can modify, the vast majority of which are in the middle part of our life. So from a personal perspective, it's about those kind of key messages of loving your heart, as we say, and that's those vascular risk factors, things like blood pressure, like cholesterol, like smoking, like physical activity, type 2 diabetes, or weight. Keeping socially interactive, so staying engaged in family and community affairs, and minding our mental health, and they're sort of key things that if people can be mindful of the impact that these things have from a brain health perspective in later life and make those small changes in middle life, that I think the impact will be very significant overall at a population level. The research in our understanding of the causes of the various dementias, particularly Alzheimer's disease as the most common one, is evolving all the time. The drug field is evolving all the time. And I do think that within the next 10 years, we will see medicines licensed for use in Ireland, where given to people who are identified early on in the disease path, that these medicines could have a meaningful effect in slowing down the progression of the disease. So I think I would be optimistic for the next 10 years. And I think from a society point of view, there's more and more awareness, and from, colleagues who work in the Department of Health, from politicians, from the government, there's a lot of awareness about the importance of both prevention in terms of what we can do to mind our brain health and preserve function, but also the impact that dementia has on society at large and the supports that people need, both drug and non-drug, to live well if that diagnosis is made.
Well, look, I think it's a nice optimistic note to maybe finish our podcast on. And thank you so much for being here and sharing all your experience and advice to our listeners, Sean. It's been really, really good. Thank you.
Thanks for having me.
So it's very clear that brain health is very complex, and the relationship between lifestyle choices and cognitive function is very important. And you've given us all the advice here. But the good thing is we can make those choices ourselves. In the middle part of our life, we can make those changes and we can help ourselves. To our listeners, please share this podcast if you think it may help somebody you know. If you want to get support, please go to Understand Together or go to HSE.ie for lots more information. On our YouTube channel, we did a webinar earlier on in the year if you want to have a look at that. You can email us on healthandwellbeing.communications.ie. Thank you very much for listening. This has been HSE Talking Health and Wellbeing.